Okay, so my name's Alex Waters, and my partner is,
Peyton went.
and we are discussing managing difficult patients. So the question that was asked about this article is, what role does communication play in alleviating the problems associated with difficult patients? Which in the article it said 10 to 12% of patients are considered difficult, which doesn't sound like that much, but I feel like that's a lot of people. If you like think about the number of patients that there are, because I feel like we're all patients at some point.
It's more than it should be.
Yeah, agreed, definitely. But then it kind of went on to talk about how mediators who are specialists in conflict management can be useful. But if you don't have a mediator, you can use some of the tools that they use, which are called maxims of mediation, that can be applicable to difficult patients. So we're going to talk about each of those.
And people that don't know the maxims of mediations usually just ditch the patient, they stop treating them because they're too difficult. So they don't receive care, whether it's in the waiting room or while they're actually receiving the treatment. Okay. So there are 7 maxims, and the first one is to view the difficult patient, as someone with or a syndrome, not a species. So I know there was an example. I think it was on our homework. But it's don't treat them as their emotions or attitude. Treat them as a patient first, and then deal or manage their emotions, because you don't know what they're going through, type of thing. Could just be circumstantial.
I kind of think of that also as in my abnormal psychology class, we're also talking about how sometimes when you diagnose a patient, you kind of apply a label to them, and then there's a stigma where there shouldn't be. If you diagnose someone with depression, then it kind of becomes about labeling that person as a whole rather than just labeling their behavior. And it should just be trying to deal with the behaviors rather than the person as a whole. And so I think that's a kind of good way of looking at it. But yeah, I think it continued to say in the article where if the interactions that were proving to be difficult with that patient were understood to be circumstantial and not due to the patient themselves.
Personality trait.
Yeah, then they'll be able to be changed. It'll be looked more easily upon being changeable, which I think is good.
The second one, the second maxim feeds off of that. And it says anger is a reactive emotion, and the key to solving it is finding its source. So like it said, a lot of people, it's just circumstantial anger. Because one, they're in a position where if you're in a medical environment, obviously something went wrong. So I think they're confused and angry and maybe
probably stressed.
Yeah. So it is maybe just that one-time thing where they're angry, but then you have to find why they're angry and understand where it's coming from to really be able to solve the problem.
Yeah, and I think usually in a clinical setting like that, a lot of times it comes with being treated unfairly or without as much dignity as they think they deserve. And so I think addressing that is a big way. Figuring out actually what's causing that is a big way to de-escalate it and also to maybe prevent it from happening again.
Yeah.
So the third one is where it takes only seconds to escalate or de-escalate a brewing conflict. And I think on the homework, it gave a good example of Dr. House just rolling his eyes at a patient.
Facial expression, yeah.
Literally, that takes half a second, and it's something most of us don't even think about. And I feel like so many people just take that in such a bad way that I think it makes so much sense that literally just one little thing could make something so much worse, or even one little thing where you take 5 seconds and think about what you're going to say.
Yeah, stepping back. Yeah. The fourth one is calling someone out for bad behavior. and making it worse. Sort of like pointing your finger. Just one, they're already in a bad mood or they're already upset about something, and then you're just like placing the blame sort of on them.
Yeah, I like how it said adding insult to injury. I think that
Yeah.
definitely kind of made a good impression of what it was overall.
And then they like defend themselves, which humans do. So they end up defending themselves and then they might throw an insult at you and then you defend yourself. So then it just like explodes.
It's an
into a
endless
bigger-
cycle you can't get out of.
a bigger
Yeah, I
mess.
definitely actually I can understand that one for sure. I've had that
Oh, totally.
where I definitely have been in an argument and someone's like, this is your fault. You did this. And I'm like,
Like, oh no.
So the fifth one is exercising neutrality ups the odds of successful conflict resolution. So basically, acting like Switzerland. I'm Switzerland in this problem, even though I'm technically part of the problem. I'm gonna try to be neutral and forget that I'm a human with emotions and try to just deal with you and your emotions and figure out what's wrong.
You avoid picking sides. So it'd be your side, supporting yourself or supporting the other person. Instead, you're just like listening.
I feel like that one is probably one of the hardest ones
Yeah.
because it also stated where you until like the problem kind of de-escalates or the situation de-escalates, you
Mhm.
have to not defend yourself. And I
Mhm.
think that's probably one of the hardest parts for me would be to just not try to validate why I did whatever I did or whoever did whatever they did.
That sort of goes back to the fourth one too, like
Mhm.
defending yourself. Yeah, definitely. The sixth one is naming the concern demonstrated or demonstrates alliance and avoids creating adversary.
Yeah, I think that one. I think that one also demonstrates that you're listening. I think it shows that you actually care that the person's upset and you're not just waiting for them to get done talking so you can talk.
Yeah, you're setting aside their feelings, like although they're important, like you're really trying to get to the root of the problem and like why they feel the way they
Yeah,
do.
and it also like I don't remember which homework assignment it was, but we also read an article where it said like you have to have your feelings acknowledged in
Mhm.
order,
I feel like that's like in
and
any.
that's the only way to be treated fairly. And I feel like that kind of goes with that.
Mhm.
Where if you feel that, something that is hurting you, I don't have the right to say that I didn't hurt you because that's
Mhm.
not up to me. And so
Mhm.
I feel like if you acknowledge that you hurt me, that's going to go a long way in
Mhm.
making me calm down.
Yes, it would. So the final one is a sincere apology or expression, which I think it's like an obvious one, but I don't think people realize how far like those
I
three
think it
words.
goes, yeah, it's so obvious that it just gets overlooked.
Yeah.
And people, I feel like it kind of goes back to the neutrality thing where it's kind of hard to be neutral, but you have to be in order to apologize. Like you have to humble yourself and realize that, okay, this hurt that person, and whether I like it or not, whether I agree with it or not, I have to be sorry that their feelings were hurt.
And I
Maybe
think at that
you
point,
don't have to agree with
Mhm.
what they're saying, but you have to be sorry for hurting their feelings.
Yeah, at that point, I think you like sort of understand the other person's side of things and like where they're coming from.
And it
Definitely.
goes back to making them feel like you're not their opponent also.
Mhm.
So I think all seven of them kind of have to work together in order. You can't just apply one of them
Mm-mm.
and pray for things to go well.
Oh yeah, definitely. Well, I think that's pretty much it.
I think so too.
Explains everything. So just putting all seven of those together and hopefully conflicts will work themselves out.
Yep. And I don't think this is only something to be used in a clinical setting either. Like you could use this every day to make your arguments or interpersonal relationships tend to go more smoothly.
Yeah, I agree. Okay.
Hey, bye. Oh God.